I didn't feel afraid. I didn't feel concerned that I wish I was someplace else or something else. I felt that, everybody knew what they were doing. My name is Mike Shanahan, and I had a heart attack on October 16th of 2009. I had terrible heartburn. I tried to treat it with Malox, then water, then milk, any liquid to see if it could put the fire out, and it wasn't working. Both of my arms were hurting. Felt like I had a wire running down the middle of my arms from my shoulder to the elbow, inside both arms, and they were hurting, and I was swinging them around trying to kind of alleviate the pain there. And I had an unusual pain between my shoulder blades, the high in my back that I had not experienced before, and I did not associate with a heart attack. Called my doctor's office and told them I needed to speak to a nurse right away because I was having some type of medical event, and they let me on right away. And I described my symptoms. She says, you need to get to the hospital right away. I would like to say I rather foolishly drove myself to the hospital. My wife had died the month before, and I just didn't feel like having the ambulance in the rescue squad in the house, and I thought I'd get over there as fast as they could get there to here. And in retrospect, that was not a wise decision because something could happen to me on the way to the hospital. So if I had to do it again, I would definitely use the rescue squad. I came to the hospital and walked in the front door and threw my health insurance card on the counter and said, I'm having a heart attack. But when I came in, I was rushed into the emergency room, and they started attaching all the equipment and the EKGs and this and that, and checking me out and giving me the clot busting drugs. And there's a lot of people scurrying around, and I could not believe I was having a heart attack. I was hooked up to the EKGs, and I said, "Are you sure I'm having a heart attack?" He says, "You're having a heart attack right now." As soon as I signed that last line on the paper saying that this is, I agree to this type of treatment, it was bang. I was in, the gurney was down, and I was flying over to the cath lab. I felt I was in good hands and that they were competent in doing their job and whatever that needed to be done. I felt peaceful about that, in a way. I felt confident. I felt assured that, things were going to go forward in a positive manner and that everything would be okay.